Crisis intervention training is a crucial part of law enforcement here in Oklahoma.
What we've been able to do with crisis intervention team training is educate thousands of officers in the state of Oklahoma on how to do our job, how to do it better, how to take care of some of the most vulnerable members of our communities, and how to keep everyone safe in the process.
For years, a federal grant paid for that training. But just before the pandemic hit, Captain Earl Pendleton found out that grant was no longer coming.
It was a bit of panic mode.
Pendleton and his team had to plan for fewer classes than ever before.
I was worried that not having funding was going to stop the progress and momentum and the validation of this program that we've had in the state. We've had a great commitment across the state.
Then to make matters worse, training had to stop completely during the pandemic. But the Oklahoma Department of Mental Health Services stood in the gap and funded the program with $1.2 million from the CARES Act.
The CARES Act funds filled a hole and filled a need that we really needed to be able to take care of because we were short on funds to get our training taken to the smaller communities. I've been to Stevens County, I've been out to Enid, to Duncan, to Lawton, to Stillwater, just Sand Springs, Broken Arrow, all over the place.
That's not the only program Mental Health Services was able to help. It also spent $2.6 million to expand technology. That includes giving iPads to officers, especially in rural communities, so they have instant access to mental health professionals.
The officer could simply punch a button, get FaceTime with a therapist right then and there, do the evaluation, load up the individual, get them to a crisis unit.
I'll just let you guys talk for a little bit, okay?
The iPads also allow officers to schedule their own confidential session with a licensed therapist.
To me, it's been a godsend for the citizens and the officers.
Officers are excited and ready to do this training, and they know it's needed, and they know that the community deserves it. So it's great to be back to doing what we do.